So my goal here is to share 5 of the Ayurvedic and traditional Chinese medicine signs and symptoms that your body's telling you that there is a heart-related issue. Welcome back, everybody. Great to be joining you here today on this brand new Cabral Concept podcast. This is episode 2679. If you want the 3 big takeaways from today's show, head on over to stephencabral.com/2679. And we're going to be going over the 5 facial features that reveal your heart health. This is really important to understand because your skin is what's referred to often as the largest excretory organ on the body. That means basically all of the waste products are being excreted a lot of times through our pores, through our body, but also our tongue, our ears, our eyes, our skin are all giving us signs as to the internal health of our body. So my goal here is to share 5 of the Ayurvedic and traditional Chinese medicine signs and symptoms that your body's telling you that there is a heart-related issue. And by heart-related issue, I mean a circulatory issue. There's an issue with the blood moving through your body, oftentimes because of closing up arteries, or there's a lot of fibrin built up, or there's blockages, there might be high blood pressure, or even type 2 diabetes, which can affect the arteries, blood vessels as well. So again, I want to share with you that I'm not providing any medical advice, medical diagnosis, medical treatment plans, or cures in any way, but these 5 tips are absolutely legitimate, backed up by science, and it's something to be aware of. All right, so first things first, the first sign that you should look for, the tip of the nose. When the tip of the nose looks like a different skin color from the rest of your face, it's a sign that something is off. Now, it can actually be a bluish color, it could be a reddish color, and it could start to get hard to the touch. These are all signs that there is potentially a circulatory issue. Sometimes we actually see the nose start to grow a bit with alcohol overuse, liver-based issues, but what we're talking about specifically today is a reddening or bluish tip to the nose, and it potentially getting a little bit harder, a little bit firmer than that kind of soft cartilage you would normally feel. That is an issue, again, regarding the circulatory heart and cardiovascular issues that may be dealing with inflammation, blockages of the arteries, cholesterol or plaque, gumming up the arteries, and much more. So again, if you feel like there might be an issue, it's a good sign, symptom to go to your PCP and say, this is a sign and symptom that I've seen. I want to be able to go deeper, looking into my heart, looking into my blood work, etc. All right, number 2 is black veins under the tongue. Everybody should have bluish, right, like light blue veins under your tongue. That's normal. That is showing the presence of not necessarily a lot of oxygen. However, when those veins are dark blue, like a dark blue, not a grayish, not a bluish tone, but dark blue, blackish, poor circulation, inflammation, potentially cardiovascular issues. Number 3, I've gone over this before in the podcast. It's actually helped quite a few people. It's called Frank's sign. It was initially named after Dr. Sanders Frank, who observed this crease in clients with angina, with heart-based issues, with potentially cardiovascular blockages and circulatory problems. So it's called Frank's sign, and it is a diagonal crease across the earlobe. It's an important one to look for because it's actually a sign for retinopathy. It can be a sign for type 2 diabetes. It can be a sign for coronary artery disease. All of these have to do with the vascular system of the body. Vasculature is basically, just think of like your veins and the arteries and the blood moving throughout your body. There is something holding it up, Could be inflammation from many different issues. Again, it could be higher levels of plaque. It could be stenosis, hardening of the arteries. It could be higher levels of blood pressure. It could be type 2 diabetes that we spoke about. So take this one seriously. Now, sometimes people will get a crease in their ear simply because they've had their ears pierced and there's laxity of the skin. That's not necessarily the same thing, but it is important that if you do have a deep crease in that ear, especially if you've never had your ear pierced, something to share with your primary care physician again. All right, the fourth one is this, puffy eyes. Now, a lot of people have a degree of puffiness to their eyes. I'm one of those people, there's no doubt about that. Now, it can be more of a Th2 dominant immune system. It can be for some people, lower thyroid. It could be from poor lymphatic drainage. Like there's all sorts of different reasons. I'm not gonna go through that today. However, if your upper and lower eyes are puffy, especially if it's maintained throughout the day, not just when you wake up in the morning as well, when your lymphatic system may not be moving as well. But when the whole eye is getting puffier, and you might even start to see deposits, like fatty deposits under the eye, it's a really good sign that there might be elevated levels of unhealthy cholesterol. There might be cardiovascular-based disease, poor circulatory issues. Again, could be high blood pressure. Please go do see your primary care physician for that as well. The last one, and as important as any of these, just a little bit more rare, but an important sign if you see this, because there's not really, meaning like there's no good reason, there's no even like mistakable reason why this might be happening. If you start to get a gray ring around the colored part of the eye, which is called the iris, if you see a gray ring surrounding that, again, I'm not giving you medical diagnosis, medical prognosis, anything like that, but you just want to make sure that you go to see your physician, just say, I'm developing a gray ring around my iris. I was told, I saw online, I read that there can be a correlation between a gray ring around the iris, the colored part of the eye, and potential circulatory and cardiovascular issues. I'd like to learn a little bit more about this. I'd like to run my blood work. I'd like to run maybe a scan for the heart, look at coronary artery blockages, etc. So those are the 5 main signs of potential heart circulatory issues that can actually show up on the face. Hopefully today's Cabral concept was helpful. Again, all of the big takeaways, all of the notes, and obviously even just a free copy of my book where you can go deeper are available at stephencabral.com/2679. Take care, everybody. Have an amazing rest of the day. Thanks so much for tuning into today's show. Before you go, don't forget to hit that subscribe button. I want to make sure that you're getting our daily content, not missing out on anything. Functional medicine, wellness, weight gain, weight loss, anti-aging, living longer, stronger, and all of the most cutting-edge research. And if there's any topics you want to hear, feel free to leave them in the comments below. Take care.